Welcome to Phase 2 of the Total Knee Replacement Rehabilitation Program. This phase covers weeks 2 to 6, focusing on improving range of motion, balance, and strength while managing swelling and pain. In this phase, the main goals are to manage swelling and pain, normalize walking, achieve over 105 degrees of knee flexion, full knee extension, and focus on improving balance and strength. Let's go over the exercises for Phase 2. These include leg elevated heel slides, quad sets, prone TKEs, bridges, heel raises, bag hangs, tandem balance, and forward stepping to help regain knee function and mobility. While lying down with your leg elevated against an inclined surface like a wall or an inclined table, slowly slide your heel toward your hip to bend the knee. Hold the position for 10 seconds, then slowly extend your leg back to the starting position. Use a towel, dog leash, or strap for assistance if needed, and your unaffected leg can help guide the movement. Perform this exercise for 2 minutes, 3 times per day. Additional notes. Video 1 demonstrates this exercise in a rehab clinic setting, while Video 2 shows how to perform it at home. Continue performing quad sets from Phase 1, focusing on achieving a strong quad contraction. Begin introducing standing quad sets as part of Phase 2, utilizing a towel or ball behind the knee for support if needed. Aim to practice the standing version for 1 to 2 weeks until you notice increased strength and control in your quadriceps. Once you've shown consistent improvement, you can gradually reduce the seated or lying quad sets, and focus primarily on standing versions for further progress. To perform the standing quad set, stand with your back against a wall, and place a ball behind your knee. Squeeze the ball by straightening your knee, ensuring full extension. Hold this position for 5 seconds, then relax slowly. Repeat for 3 sets of 10 repetitions, 2 to 3 times a day. This exercise strengthens your quadriceps and promotes knee extension. Focus on control and reaching full extension with each rep. This is the same standing quad set exercise as shown in the previous slide, but with a towel instead of a ball. It's the same exercise, so follow the same steps. Straighten your knee, squeezing the towel behind it, and hold for 5 seconds. Complete 3 sets of 10 repetitions, 2 to 3 times daily, focusing on full extension with each repetition. To perform a prone terminal knee extension, lie on your stomach with your ankle flexed, pulling your toes toward your head. Press your toes into the floor, mat, or bed. Extend your knee, lifting it off the surface. Hold for 5 seconds, then slowly lower your knee back down. Repeat for 3 sets of 10 reps, 2 to 3 times a day. Focus on controlled movements and full knee extension. Bridges. Lie on your back with knees bent and feet flat. Lift your hips by squeezing your glutes. Hold for 3 to 5 seconds. Slowly lower back down. Do 3 sets of 10 reps, 2 to 3 times a day. If it feels easy, add weight or try lifting one leg. To perform heel raises, stand with your feet hip-width apart. Lift your heels off the ground so you are standing on your toes. Hold this position for 1 to 2 seconds, then slowly lower your heels back to the ground. Do 3 sets of 10 repetitions, 2 to 3 times a day. If this becomes easy, you can add weight or try standing on one leg for more challenge. In Phase 2, partial squats with hand support, help support build leg strength and knee control. Stand with your feet shoulder-width apart and hold onto a table or countertop for support. Lower yourself into a shallow squat, keeping your knees behind your toes. Hold for 1 to 2 seconds, then return to standing. Perform 3 sets of 10 repetitions, 2 to 3 times per day. Focus on moving slowly and with control, using the support as needed. To perform the tandem balance exercise, stand with one foot directly in front of the other, as if standing on a straight line. Keep your arms at your sides or use a support if needed. Hold this position for 10 to 20 seconds, then switch feet and repeat. Perform 3 sets, 2 to 3 times a day. To make it more challenging, try reducing the amount of hand support you use. This exercise is a progression from Gait training part 1, and should be started once you're comfortable with the previous exercise. After placing your heel and foot flat on the ground, press down firmly through the ball of your foot. Shift your weight onto the leg, ensuring your knee stays straight, by tightening your thigh muscles. Hold this position with your knee directly over your foot for a brief pause, then return to the starting position. Repeat this movement for 30 repetitions or continue for 2 minutes. Perform this exercise 2 to 3 times per day to further improve knee stability and strength during walking. Backpack hangs continue from phase 1 to help improve knee extension. Start by elevating your leg on a chair. Then, place a backpack loaded with 1 to 10 pounds around your knee, with one strap above the knee and the other below it. Let the weight gently straighten your knee through gravity, holding for 3 to 5 minutes. Repeat this 3 to 5 times a day. For detailed instructions, please refer back to the Phase 1 video. Before moving on, let's quickly review the Phase 2 exercises. These include leg elevated heel slide, quad sets, prone TKA, bridges, heel raises, squatting, tandem balance, forward stepping, and bag hangs. Make sure each of these exercises feels comfortable and controlled. This foundation will help you succeed with the more challenging exercises in Phase 3. As we wrap up Phase 2, remember that this phase is essential for restoring proper movement and preparing for more advanced exercises. Continue to follow your therapist's advice and listen to your body. Once you're comfortable with these exercises and have met your goals, you'll be ready to move on to Phase 3. If you have any questions, feel free to contact your surgeon and rehab team. For more details and guidance, you can scan the attached QR code to access the full rehabilitation protocol.